So I'll come to a role of AI in education. Most of us in healthcare, in hospital system, say 5 years ago, if you say we're using AI, we were using what's called NLP, natural language processing, like from the patient notes, from radiology, summaries, and we're primarily using NLP, a lot less than image recognition and segmentation. So NLP is a subdomain within AI, and large language models are a subdomain of NLP. So why do we need NLP? So if you're a physician, you can write heart attack as myocardial infarction. You can just put MI in the notes. They all mean the same concept. And suppose we are doing research on this end, we say, I want to find all the patient who had a stroke, who had a myocardial infarction. I want to pull all those notes. You have to do NLP to find all the patients that had these particular symptoms or particular disease or diagnosis, right? Similarly, type 2 diabetes, I can say in multiple different ways. And as a humans, we are very creative in coming out different ways to say the same thing, right? So in NLP, one of the tasks of NLP is called named entity recognition, is to identify concepts within a node, within text or unstructured text. So an NLP engine, including large language models, what they're doing is on this side, they have access to a lot of documents. They process the parsed documents. On this end, they start annotating those documents. They start extracting information, marking those information within those documents. LLM do a little bit more than that. I will come to that in a second, but typical NLP pipeline looks like this. So you have a specific a set of documents. It could be patient notes. On this side, you basically tagging them. It could be simple things like you're identifying, disease diagnoses, location information or markers and so on. It could be even something more serious, like you're tagging the note to see if this particular patient is at a risk of suicide. So NLP can start thinking about sentiments, how things were expressed, what concerns, like you can do a lot more granular, multidimensional NLP. So one of the projects I did for a company called ScholarRx, this is like 7-8 years ago, was look at all the content they have, educational content, and identify important concepts in the content, but link that to something that helps understand those, like link that to first aid book, link that to Wikipedia, and also find related concepts. So one challenge was, how do you find related concepts, right? So we're looking at abdominal aorta, and then I can quickly see, okay, these are the related concepts I need to study, right? The related concept could be on a same plane, or it could be like a prerequisite and a post-requisite. You need to know these things, 5 things before you understand this. And then once you understand this, you can go to the next level. We can even extract that way. So we did that project. We built an NLP engine for that. And we built a graph to understand how to extract the related concept. For example, in a textbook, if a paragraph has 2 concepts, they are related, right? If a sentence mentions 2 concepts, they are related. But that relationship also could be defined by the verb in between. So we can do what's called information extraction at a deeper level than just say co-occurring things. So how is that helpful? We're looking at as a learner, right? I can go back and I can click on things, I can learn more. I can click on things, I can learn more. But think of this as at a school level or a curriculum level. We want to find coverage. Say, for example, last 4 years we taught women's health. How many topics were taught under women's health? And that could be 100 topics. That could be 50 topics, right? NLP can help you find really, okay, we used to teach women's health across all these courses. Now we're teaching only in these courses. I'm just using this as an example, right? But every year we are increasing or decreasing coverage for a particular topic. Similarly, we can basically say, as topics evolve, which topics now we're seeing more across all curriculum. So as an NLP engine, you can process 30,000, 40,000 documents in your entire curriculum in a few minutes and get a feel of what is our coverage. We can benchmark. And this could be comparing one school to another school's curriculum. So we have done projects for this, and I did have some screenshots, but I removed it because it was from Vanderbilt. So coming back to large language models. let me pause here for any questions so far.
Yeah, Dr. Syed, I had one question. How will this work in a case where the link medically is not as straightforward? Like, for example, if you have like a renal problem that leads to a bone density problem due to like a loss of calcium or phosphate or something like that, how is it able to tell, like, is it a separate field for saying a second degree effect of a disease process, or would it be considered the same field of NLP?
So great question. So as you can see, the evolution of how AI has evolved is initially we were building rule based. So we basically capture all possible rules, like A causes B, B causes C, C may not cause D, right? But that is easy to do in a very, very narrow domain, but it gets really unwieldy as a domain, like medicine is a huge domain. So we, after a while, realized it's actually challenging for humans to write all those possible rules. On the other end, large language models, we are looking at millions and billions of documents. And as I showed you the simple example of, we have a sentence, we have multiple concepts, and we can say these are all related because they happen to be in the same sentence. But within the sentence, you also have verbs, you also have adjectives, you also have things that connect them, right? Now you're looking at million documents, you start to build different layers of, I'm going to use the word quote unquote intelligence that seem to mimic what humans do when we look at a document, when we read a document. So as an AI engine, there are two parts. The first one is the modeling, and the second one is inferencing. So GPTs are, pre-trained transformers that give you a specific output. Like it could be, audio, it could be video, it could be a text, it could be, a specific output, right? So when you're modeling, you're basically crunching all that information into a multi-layered network. So again, can AI get everything 100% correct? Not really. Can AI, when it's giving output, can give everything 100% correct output? Not really. Because if it's garbage in, it's going to be garbage out. But if you train it over like 80 billion parameters, most of the thing, like, do the 80-20, right? 80% of the things is been repeated so many times, you're going to get it correct. How deeper a sentence, like, for example, if you're learning, we have different, like in Bloom's taxonomy, right? We what level we're learning things. Similarly with AI too, the models are getting better at crunching multiple times the same data, so they can basically move a little bit higher into the Bloom's taxonomy, right? Answering first level questions versus second level questions and third level questions. Again, this is still, very challenging problem. We're seeing newer models. Some perform better in one aspect, some perform better in other aspect, but it's still an open problem. So simply said, a large language model is a complicated example of things you've already been using for when you're texting. When you're texting, it gives you a recommendation for the next word to type, right? So it's predicting the next word. So LLMs are basically complicated versions of next word prediction engine. So it can predict next word, it can predict next sentence, it can predict next paragraph, it can predict next page. That's an LLM. So that's the same evolution. So we've been using AI for a really long time. If you remember the first time you had recommendation when you're searching for a product or when you're searching in Google, it recommending you, keywords to search, autocomplete in Google, right? This is all AI. So let me continue. We went over this, AI again, it's built on incremental progress we have done over last 3-4 decades. But last 3-5 years, things have gone really exponentially because of the investment that has gone into building these models. TensorFlow existed, GPUs existed 10 years ago, but the amount of investment has gone because the company OpenAI is one of the pioneers in this space. They came up with ChatGPT 1, but I think by the time they released 2 and 3, they realized they're onto something. And as you can see, the amount of data it's been trained on went from 117 million to 1.5 billion to 175 billion. I think for 4, they didn't even put the number out. So again, it's like a tire. Every time you flip it, it gains exponential size. So, but we have a lot more data. Like again, the AI is trained on the data they had access to. You have to remember that. Most of our patient data is not on the web, thank God, right? That is behind the firewall in our databases, right? This AI is trained on what they could access for free. That's really important. A lot of actual text, for example, publishers have really good content, but it's not on the web. So AI is not trained on that. A lot of databases, like all domains have databases that AI is not trained on yet. That's where the new AI, that's where all the companies are scrambling to get AI into their systems to implement the AI, is because they realize, they could do a lot more with that, right? But so the new AI is generative AI. Typically, AI would basically say, this is a cat or this is a dog, right? But now we can train an AI to generate a picture of a cat. So that part is a new part. That's the generative AI. And it comes with both, there are benefits, but there are also things we have to be careful. Bias. If the data that is trained is biased, is incomplete, the AI system will basically, for example, I'll go back to a simple example, right? Cat and dog. If the AI engine is trained on pictures of cats, but there was no picture of Siamese cat in there, and you give picture of Siamese cat for AI and say, what is this? It may not give a right answer, right? I'm oversimplifying it, but you get the idea, right? So if the data is not there, if the data is missing, data is biased, there'll be bias in there. Manipulation, social media, that we have last few years, we realized, generative AI can make this even worse, especially disinformation and deepfakes and so on. And we have every domain, this year, last year, we've been talking about impact of AI. But I'm optimistic in this one. I'll come back to that in a second, especially in medicine. I'll say AI is not going to replace doctors. So if any one of you have anxiety about that, I want to put that to bed. AI is not going to replace doctors. I saw a quote other day, was over radiology. It said something like, radiologists will not be replaced by AI. Radiologists who use AI will replace the radiologists who don't use AI. So it is important. Like, you attending this session shows that you are interested in AI. Please be. This is an exciting field. It's not going to go away. It's not a fad. It's not a hype. This is built on solid foundations. There is some hype in, like when you go to stock market and so on, there is hype there. But implementation wise, people who've been doing AI like me for the last 2 decades, we have been working hard to make this happen. So it's not going to go away. There's a lot of strong AI infrastructure that's been built. There's a lot of substance already. There's some hype in the market, but not in the medicine. So you have seen this, like AI can pass. Again, these are all good. It makes good headlines, but I would not be worried about this, because doctoring is more than what AI can do. Think of AI as, like, if you have the best technology, you want to use this. You want to use that technology for your patient care. So AI, you want to know which is the best AI. You want to know when AI is not working. For example, if you have an adverse event and you are the first person to know this drug is not working, this drug has some adverse side effect, right? Similarly, you be the first person to detect when AI algorithm is not working well. So you need to know how AI works. You need to have competency on when it is working well, when it has a bias, when it is hallucinating, when it's completely creating risk to patients. So I'll go back. I was talking about the data the AI is trained on. So for example, OpenAI, ChatGPT, or Llama or DeepSeek, they're trained on open source, open access, whatever is freely available on the web. What about all the data we have in our EHR, EMR systems? So Microsoft and Epic, and I think also OpenAI, they're partnering to bring that to your MyChart. So this will happen. I think Cerner and Oracle bought Cerner, and they're working on bringing AI-based EHR system. So this is coming. This is not going to, like 10 years from now, this is going to be few months or next few years. Right. So I'm excited about this. Again, we have to be, we have to have a healthy dose of skepticism, because don't believe everything you see, knock on it, see if it's working well or not. That means you have to know where to knock. So AI in medical education, I have some examples of the projects I'm doing. I'll quickly go over that. Can be used in multiple different ways. Of course, for grading, creating exercises. I have a project for that, but also personalized learning. This is something I'm very interested in. I'll come back to that, what it means. But also, there are a lot of tools out there that will help you do research really fast. Access to information, create content, facilitate learning, AI tutors. So there's a lot of language translation is a good example. So a lot of use cases of AI you'll see, and you already probably are using a few of the AI tools for these purposes. So I will switch to the next topic, AI literacy for physicians. Any questions before we switch to next topic? Okay, so what should I learn as a physician? Again, this will change if you ask me next year. If you ask me 5 years from now, definitely will change. So let me go with some of the things I have put together for our McGovern Medical School. These are, if you want to take a screenshot, please do. These are, I think, some of the topics you should at least be aware of, like have like a Wikipedia understanding of these concepts. So what somebody's talking about, right? What you can understand what somebody's talking about. Based on your discipline, like where you match, you may jump into very particular, for example, if you get matched in radiology, you want to learn more about AI in radiology, right? If you get matched into family medicine, you want to learn AI more about, digital health and all those things, right? If you get matched in internal medicine. So again, it's a very, medicine is big. AI will impact all aspects of medicine. So, first introduction to AI, what is machine learning, what is deep learning, what is large language model, especially, I forgot to put here, prompt engineering, or how to write really good prompts. Again, this is an evolving thing. So, if you're starting with 4.0, ChatGPT, or if you're using Gemini, spend some time learning prompts. Just like writing language, you'll get better as you write more. Those who have never used a prompt is like English language, a sentence where you're telling the AI to act as somebody and create a document or solve a problem. You're communicating, but again, it's still an engine, it's still a machine. So if you form the prompt really well, it will give you better answers, and you can continue what's called distillation, continue honing the prompt until you get really good output. And AI engines also have what's called reinforcement learning. So once it understands what you're asking, it will try to personalize to you. So more you use the same AI engine and more you do the prompting, it'll give you better and better results. Okay. So the second one is clinical relevance. We talked about NLP, we talked about supervised and unsupervised learning. Clinical decision support has been a big field for the last 12, 15 years. That I think you should also look into, a lot of rules, like when you go and order two things, and it'll have a prompt saying that you sure you have to do some different dosage and so on. All those is coming from clinical decision support that have a long history. On the patient side, ethical concerns, mitigation strategies, where the bias is. Of course, radiology. I've also been working on a project using voice as a biomarker of health. Voice, I think, is going to be an important data source. Like, we don't see voice as a data, but it is going to be a big domain, because we have so many devices. Like, we talk to Alexa, we talk to Siri. For example, using voice, you can detect if somebody has an early onset of dementia just talking to Alexa every day, right? So that is important data for AI to start doing preventative or early detection. So I like this paper from my colleagues at Vanderbilt. They came up with 6 competency domains that physician training, I think this lecture should focus on. So I will not go in all the details of this, but this is a good paper to read if you want to understand the breadth of competencies as a future physician would need. Again, as you can see, it's written in a very general terms, like they're not talking specific AI techniques or models, but looking at across, like, social ethical implications, evidence-based evolution of AI tools, workflow analysis. So this is a really good paper that gave, the core competencies you need for AI in medicine. So quick, some of the projects I'm working on, I will not spend a lot of time on this. And quick disclosure, this is a UTHealth project we just spinned off as a company. What this platform QuizTime does is it helps create for physicians, physicians and faculty, it helps create content, especially multiple choice, assessment, formative assessment content. And the platform is also designed to deliver the content to the learner. So this is the LLM part. You upload a document, you have a PDF, PowerPoint, or you can copy paste and you say, I want to create these many questions, and it'll generate those questions. So this is easy to use tool. I do have another case study using this platform. I will talk in a few minutes, that where we evaluated human expert generated questions with AI generated questions, and how do medical students feel about that. So our goal is to reduce faculty burden in this project in creating questions, using AI to create questions, but also test if students think these questions are good. So we did that study. We had, this was a second-year McGill Medical School. The study was conducted with the second-year medical students. And Akshat was the lead for this study. We had 2 groups. We had, in terms of the data set, we had human-generated or expert-generated questions and large language model-generated questions. And we sent those questions to our participants every day for 28 days, 4 weeks. So we wanted to see the study over time. And every day we divide the participant into 2 groups. One will receive human questions or expert questions, other will receive AI questions, and they would not know which one is which one. And then every day we would randomize again, and next day, random 50 will get AI, random 50 will get human question. So we had 30 participants, 20 completed the whole study. We had pre and post survey, so 29 and 22. So this is interesting. So one of the questions we asked on an everyday basis, the learners at this point, they don't know whether the question is AI or human or expert. We asked them, rate the difficulty of this question. With the questions that were AI generated, as you can see, 38 plus 7 rated difficult, very difficult. Whereas those who got human or expert questions, about 24 plus 3 said it was difficult, very difficult. So AI was able to generate, questions in terms of difficulty level close enough or better. We also asked this question. At this point, they don't know which one is which one, right? We asked them, what do you think? Do you think this is an AI question or a human question? So this is interesting. For AI generated questions. 55.6 thought this was a human question. For a human generated question, 52 thought this was an AI question. So this is a toss up. I mean, this, at this point, it's the students did not couldn't guess which one was AI, which was human, right? Or they were thinking maybe it was horror, so it was AI. So what does it mean? Like where we are today, compared to other domains, education, there's a lot less investment of AI in education. Actually, there's a lot less investment of anything in education in terms of grants and so on. But here, as an idea I had in 2015 to build what I call the curriculum GPS, and this is a graduating class of Vanderbilt at the time. So took a picture. You can see we have lots of students, and on each of the students we have lots of data. Like every click, every video they watched, what speed they watched, how long they watched, when they watched, from what to what they watched, when they dropped out, how many quizzes they taken, which answer they selected. We have lots of data on each of the student in our systems. And the goal is, can we make it personalized? So imagine an AI engine that is very personalized to each student, that understands the student where the gaps are. It helps them learn better, make things easier, identify the gaps, tell them in order to understand this topic, looks like we need to understand these 3 topics. Here's a YouTube video to watch it. Here's a, an article to read it, right? Here's a paper, right? We need to build that machine. So that's the idea I had in 2015. We didn't do it. I presented that to our dean at that point. We didn't do it. Why do we need this? Like, if you look at our phones right now, and in 2015, we used to have this thing called Garmin and TomTom that was a GPS every car had. We have this. GPS knows exactly where you are. If you tell them I want to go to another place, it'll tell you 10 different ways you can get there. If you get lost, it'll correct you again. If you tell, avoid tolls, avoid freeways, it'll tell you. Like, we have those systems, but for our education, we don't, right? So we need that. That's the idea of what's called precision education or personalized education. So let me pause here for any questions.
Dr. Syed, these are phenomenal points. We see right now in medical education, a lot of medical students, not even just medical students, a lot of people in general are using ChatGPT for clinical, just like reasoning. We see HMS, like Harvard, just is now integrating Gen AI into their healthcare, their medical school curriculum. And so how do we, like, putting yourselves in the shoes of a trainee, what's a thought process we can lead to prevent ourselves from over relying on AI generated recommendations while also maintaining a strong diagnostic intuition? Because what can happen is a lot of students rely on GPT as like, oh, let me checks and balance, to where it can also maybe decrease their clinical reasoning or diagnostic intuition. So is that a concern you see? Is there a way students can prevent that when they're using GPT?
This is it's a great question. It's a difficult question to answer, because we are all, not just medicine, but other fields too. We're all in the same, I would say, challenging/exciting period. The challenging period is the traditional model of education is, you memorize everything, you understand everything, you can answer it, you can repeat, things sometimes verbatim, right? I think that is probably going to change. So we are kind of at the if you draw 2 Venn diagrams, past and future, we are at the intersection of past and future. And I can say what future looks like. Like Einstein said 100 years ago, if I can find anything in 2 minutes, I don't memorize it, I don't remember it, right? So again, things are changing. Like my kids, if you ask them to search for something, they will just go search on YouTube first, right? Like we'd never learned from YouTube, right? We would go find something in a book, right? Libraries have a Dewey Decimal System invented, so you can find the book faster. Like, I don't think my kids are going to learn what Dewey Decimal System is. So we are at the intersection of past and future. So this is both challenging and I think exciting. I want my future, again, as a patient, what do I want my doctor? I want my future doctor to use AI. I want my future doctor to use the best technologies he or she they have to help me as a patient, right? For example, a 17-year-old walks into a clinic and we have data on them for the last 30 years. There's no way you can process and parse and read and understand all the data that happened, everything that happened to them, right? But AI system can. AI can help you quickly identify, okay, it looks like you're looking at Mr. Smith and you should ask these things. They have these things. AI can quickly summarize for you. Because AI is not going to sleep. It can keep processing all the patient data. Like, for example, if you have one of the patients, say you have Apple Watch or Fitbit, amount of data those things generate, there's no way humans can process all that. It has to be run through an AI machine. So ChatGPT is an example, but again, there are more and better AI tools will be developed in the next 5-10 years, or even next 2-3 years. That will make things simpler. Again, does it change our behavior? Yes, like how we access information, how we treat patients. Hopefully it'll get better. So I'm not worried. As being a doctor, I don't believe is, if you remember 100 things, you're a doctor. I think it's more to that, a lot more to that. But using AI, learning how to use, just for example, the doctors trained in 2025 were all trained using an EHR, right? Mm-hmm. Doctor trains 30 years ago were writing on a piece of paper, right? So would you want to be trained on an EHR, or would you want to be trained on a piece of paper, like writing, paper charts and, right? That is gone, right? That is gone. We moved on to digital format. Similarly, we need to learn how to use AI better. So as a physician, you are, from the patient perspective, the improvement in patient care, I think we'll see a lot of innovations. For example, a lot of physician time is spent in writing notes, taking, that I think will be all gone. There are already companies that can record the conversation and input all the information in the charts, input all the, take the presenting problems, like all that is, if you're in psychiatry, you spend a lot of time writing notes, right? Now the conversation will be captured directly by an AI. And the other things, for example, a lot of things, somebody was asking a question the other day, what about radiology? Like some of the fields seem like very close to, okay, like AI can do this, why would they go to doctor, right? I don't believe that. For example, when you have a new technology that makes things simpler, we tend to go a little bit higher to figure out how best to use it. For example, if we go get an X-ray, typically you get one angle or two angles, but a technician will take multiple angles just to get things right. All the data is available, right? So AI can actually process all those 10 angles faster, better, right? And then give diagnosis. The doctor can help. Okay, now I want to recommend this and this and this. So I think things will change, but I'm not worried about AI will replace or AI. I don't see concern. I think from patient perspective. As a physician, you want to use the best technology you have to improve the patient care.
That's a phenomenal point, and I think that's a good segue into a question we just got as well. So, are you involved in any sort of like this AI personalized education? You or your colleagues, are there any projects for this topic via Aim Ahead where students, trainees can be involved?
Yes. I just moved about a little more than a year ago from Vanderbilt, so I'm still kind of transitioning. So I'm very involved in, if you draw the Venn diagram, AI and education and healthcare. That's the three areas, intersection of these three areas is my research interest. So I have projects. I'm also involved with some large NIH projects where we are looking at AI across healthcare and taking a different take. Instead of doing projects, we are helping other people create projects, create mentoring, give funding, and so on. So it's slightly different way to do this. But the short answer is yes, I am very interested. I have 2 projects that are currently in AI and education space. So if you're interested, I will share my email. Please reach out. So opportunities for medical students in AI. I want to share one. I'm part of a project called Aim Ahead, and we have built a network of more than, I think it's close to 7,000 AI machine learning experts, healthcare experts who are on this platform. A lot of mentors, a lot of faculty. You can join as a trainee. You can join as a mentee. We have lots of AI courses on different topics, including AI for frontline workers, including AI machine learning courses for physicians, healthcare providers. So all these courses are free. We have a lot of resources. We have access to data sets. We have also access to paid training programs. How does that work? So we have launched 5 training programs. We just recruited 155 trainees across the country. Trainees get $8,000 stipend to work for 8-month project on AI machine learning. We give them funding for 8 months. We give them access to data. We match them with 1 or 2 mentors based on their needs. We also give them compute, like access to cloud computing. And so we just launched 5 programs, total about 155 trainees, and about 70 mentors we recruited, and both mentors and trainees are paid. So both have skin in the game. So we'll be launching a few more programs in next, I would say, first or second week of March. So please join the platform. We have a lot of free courses. We have access to data sets. It's a community of folks who are working in AI and healthcare. Okay. Here's my email. Please feel free to reach out if you are interested in AI plus education projects. I've been working on this since 2012. Before ChatGPT, we have built a lot of systems. I'm excited about large language models. It's a fast evolving field. But also, we SBMI released our own internal HIPAA compliant large language model. I don't know if my own students were shared that. So I'll see if I can find out if I can share that with everybody. But the SBMI students have access to an internal HIPAA compliant large language model. But you will see most of the schools, most of the companies will start implementing their own LLMs. But we'll also see AI implemented on different platforms that already exist. So think of this like before 1995, 98, personal computers were not connected, right? Then we connected them to internet. And a few years later, everything changed. Like we buy everything on internet, we talk to people on internet, we have been having this session on internet. The internet changed how humans connect, buy, watch TV, like, we watch TV on YouTube or we watch TV on Netflix, right? Similarly, AI, think of AI as how internet changed, AI will change similarly. But it'll hopefully make things better. If you're not careful, it can make things, worse. Any questions?
Yeah, I just had a quick question about the paper you mentioned that the MS2 worked on. And I noticed that difficulty and whether or not it could be determined by if it was AI generated or not was kind of the criteria they all used. So I'm wondering, like, what do you think are the relevant criteria for analyzing good AI generated questions? Because I guess from my perspective, like a question being difficult doesn't necessarily mean it's a good question. Because I've seen a lot of questions that are just like convoluted or just want you to remember some small piece of information that's not that relevant. But questions that are easier can be better for clinical reasoning. Or easier can be better for clinical reasoning. So I'm just wondering, like, what are the criteria you would say that we should use when we like approach an AI generated question?
That's a good question. Lot of this is still subjective. Like, there are knowledge retrieval questions, right? You're just asking if, what's the capital of, France, right? Versus, why did Napoleon invade, um, say, country X, right? Or the economic factors during Napoleon time that impacted the, peasant population. So as you can see, the level of understanding on a subject, the question can capture at a different level, how you phrase the question. So as we go from, you say, from middle school to high school level and in college and university, right? The composition or the essay questions, or like, taking, SAT versus GRE or a GMAT, the level of understanding comprehension is asked differently. So one way to rate questions would be simply what level of grade this question is asking, right? For example, is this a middle school level retrieval question, or this is, a master's level, comprehension question, or this is, you are writing a thesis on this question. So again, it's subjective. There are different scales, there are different frameworks that rate questions based on level 1, level 2, level 3. Simply what I've seen is also the grade level is one way to do it, like I simply said. Like in medical school, is it medical school MS1 level, or MS2, or MS3, MS4, or is it residency level, or is it fellowship level? Same topic could, you have a different, you're expecting different level of understanding from a fellow versus an MS1. Sorry, that's a long answer. I could have summarized it. Any other questions?
Yeah, we had one more question. So for all the people on the call that are in education or part of administration to like create education, right now it seems like a lot of the way the digital health shift is going, there's a lot of cross-sector collaboration, whether it's a physician trainee with the researcher, or a nursing student with the researcher and AI, just to bridge both of those worlds. So could you give us insight on the skills we should pick up to make sure we have successful cross-sector collaboration with these researchers? A lot of us on call, or even those listening, may be interested in being involved with innovation. So how do we make sure we're having effective collaboration with these different partners?
That's a great question. Medicine, like, you're looking at a patient as a team. So you have nurse in the team, right? You have based on the situation, anesthesiologist in the team, or you may have other technician in the team. So it is teamwork. So in terms of collaboration, before you collaborate, we, as a part of maybe electives, as a part of, your personal learning, understanding, for example, I'm coming from technology informatics perspective. I want my physician to know a little bit about technology. Okay, that's one, right? On the other hand, you also want to know a little bit about, different domains within your sphere based on your discipline. So best way to learn, I'll go back to the question you're asking, cross-sector collaboration. For example, I would urge everybody on the call to think like an entrepreneur, because we need ideas. This is a great opportunity for you to think of an idea and solve a problem. Because at this point, like if you remember, 25 years ago, we had a lot of companies that started using internet. And some didn't work out, but a lot of them worked out. One of them is Amazon, right? Google is one of them. Yahoo is one of them, right? So we are the same kind of situation. So your ideas could be very impactful. So think of ideas and then find people to collaborate. Again, you may need 2 people, you may need 1 person, you may need 10 people, depends on the, the idea you're implementing. So this is a time to think of ideas to solve actual problems. And, the barrier to entry is not much. You have an account for ChatGPT, you can test things out. So this is a great time to think of ideas, find problems, find pain points, and you'll be surprised that idea could have a huge impact.
That's phenomenal insight, especially for those involved with education. This is good insight on how curriculums can be tailored to think more from like a case-based study or interdisciplinary collaboration or entrepreneurship, like sessions during like medical school, nursing school, whichever curriculum. So that's phenomenal insight, Dr. Syed. With that said, we want to thank you so much, Dr. Syed, for sharing your insightful and also tangible insights on how AI is transforming medical education, and more so where students need to focus their efforts to ensure we're equipped for the digital health shift. And so at AI Med Trailblazers, we are really committed to expanding AI education opportunities for trainees across the country. If you haven't already, we encourage you to follow us on LinkedIn, subscribe to our YouTube channel, join our email listserv so that you can stay engaged with the latest AI advancements and education opportunities in healthcare. Additionally, we're going to be launching the AI Med Trailblazer chapters around the United States. And so if you're a trainee on the call or listening right now, and you're interested in bridging AI education at your academic program, we'd love to collaborate. So please feel free to reach out to us. Once again, thank you everyone for joining us tonight. We appreciate your engagement and looking forward to seeing you at future events.